Hello, everyone. Welcome to another episode of the Health Tech News brought to you by Medics in Tech. My name is Glory, and I'm super excited to welcome you to another episode where we bring to you the latest updates happening in the world of health tech globally, especially in Africa. I have juicy updates for you today, especially the last update. Emphasis on the last update for today. So, ensure that you stay to the end of this update so you don't miss out. Stay tuned, and now we'll be right back. Welcome back. First on the news, Mauritius launches a $13 million e-health project to digitize national medical records. Mauritius has launched a nationwide e-health project to digitize medical records and modernize its public healthcare system. The large-scale initiative aims to improve the efficiency and quality of patients' care through digital transformation. The e-health project is built on the principle of one patient, one file, which will provide every citizen in Mauritius a single electronic medical record that is accessible across all hospitals and healthcare centers. The rollout of this is already underway, with hospital staff receiving trainings on how to use these tools at several pilot facilities. The government of Mauritius assured that this solution is highly secured and accessible to only authorized professionals. And of course, it's going to reduce the loss of paper records and streamline patient care pathways. Now, the good news is the United Nations Development Programme, UNDP, is partnering on this initiative, which is expected to cost about 600 million Mauritian rupees, or nearly about $13 million. Now, this data will be housed in the government's National Data Center, protected by international security protocols and continuous monitoring. The system will also allow patients to access their records via an online portal and a mobile application. So, this paves way for more interactive and connected healthcare. While this project may face challenges related to digital inclusion, particularly for the elderly or people that are less familiar with digital tools, it's still an innovative solution that should be embraced because it reduces administrative tasks, reduces endless paper record system in the hospital, and also provides an opportunity to experience a transparent and connected healthcare system. And it's also key to building a more modern, transparent, and responsive healthcare system. So yes, this is it. A lot of hospitals are transitioning from paper records to digital record system. So well done to the Mauritius government for embracing this innovative solution. So that's it for Mauritius. Let's get to the next update. Next on the news, Western Cape approves first AI policy for public healthcare. The Western Cape government has approved its first provincial artificial intelligence AI policy framework for public healthcare, establishing ethical barriers to balance innovation, patient safety, and humanity dignity in a resource-constrained health system. Well, while this is an important progress report, let's take a backstory as to why it's important. South Africa faces severe shortages in healthcare resources, with only 0.31 doctors per 1,000 people, far below the World Health Organization benchmark. Now, as patient demand exceeds the hospital system capacity, AI has come in to enhance diagnostics, efficiency, and service delivery. However, integrating AI into a sensitive environment like healthcare, where privacy, dignity, and equitable access are paramount, comes with significant risk. So, the Western Cape's policy aims to balance this tension by embedding strong ethical principles into decision-making. Now, let's take a comment from the Western Cape government about this policy before we move on. The Western Cape government stated that when used thoughtfully, AI strengthens the work of nurses, doctors, and specialists rather than replacing them. We must lead with integrity, transparency, and respect for human rights to ensure that technology serves people, not the other way around. Yes, 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 that is very important. And I love the fact that the countries in Africa are now putting policies in place to guide the use of artificial intelligence and digital tools. And you would agree with me that this is very, very important. Privacy must be protected. Now, back to the policy. The 5 ethical principles guiding the framework of those policies are: 1. AI must serve the public good. 2. Systems must protect privacy, minimize bias, and avoid harm. 3. Final decisions remains in human hands, not machines. 4. AI should not entrench or create discrimination. And lastly, citizens deserve to know if, why, and how AI tools are used and who is accountable. All the frameworks mentioned are very important, and I specifically love the third one that says that final decisions remains in human hands, not machines. So well done to the Western Cape government for this policy that will now take effect in the country. And that's it for this update. Let's move on to the next. A new partnership has positioned Sierra Leone as a hub for global health innovation. The Helibron Department of Population and Family Health, POPFA, at Columbia University Mehman School of Public Health has entered into a landmark Memorandum of Understanding, MOU, with Sierra Leone's Ministry of Information and Civic Education to expand collaboration in education, training, and research. This MOU was signed by Toai Ungo, Professor and Chair of POPFA, and Honorable Chenobar, the Minister of Information and Civic Education. The agreement represents a shared vision to generate evidence, strengthen local expertise, and shape policies that improve health and development outcomes in Sierra Leone and across West Africa. Okay, now that you know what this Memorandum of Understanding entails, let's take some comments from the parties involved in this signed agreement. According to Dr. Ungo, investing in research and training in Sierra Leone is not only vital for the country, but also strategic for the region. Sierra Leone's dynamic young population, its growing academic networks, and its commitment to gender equality and human rights make it a powerful hub for innovation in global health. Minister Bark also emphasized the importance of this partnership for Sierra Leone's future. According to him, Sierra Leone's greatest asset is its young people, and investing in education is how we invest in our future. By deepening educational and research partnerships with Columbia University, we are building a center of excellence in West Africa, one that generates the evidence we need to drive health, equity, and sustainable development. This kind of collaboration strengthens not just Sierra Leone, but the entire region. Now, to round up this update, it's important to note that this partnership builds on POPFA's half-century legacy of working alongside governments and communities around the world to address pressing health challenges. So I hope this partnership yields the needed results, and I hope through this partnership, Sierra Leone will be able to raise the next generation of leaders that will advance health, equity, and sustainable development. Now, let's move on to the last updates for today. We've arrived at the last update that I told you not to miss from the beginning. This particular update is an exciting, juicy opportunity brought to you by Medics in Tech. Okay, let's get to find out already. From Medics in Tech, we're excited to announce the launch of the Learn the Basics of Healthcare AI and Data Challenge. Yay! So, this is a call to all healthcare professionals and students in Africa to build the foundational skills that will define the future of medicine. So, you're not just going to be learning skills. You're also going to get the opportunity to use your skill to create a solution and stand the chance of winning exciting prizes. Now, here's a breakdown of the reward system for the challenge. First place goes home with 150,000 naira. Second place goes home with 100,000 naira. And the third place goes home with 50,000 naira. Now, that's not all. Our top 3 talent also get a guaranteed exclusive mentorship placement. So, you're not just going to be going home with prizes, you're also going to be paired with a mentor that's going to help you shape your skills and expose you to the world of opportunities. Lastly, to another juicy part, everyone who finishes this challenge wins. This means that all participants who complete the challenge will get a full year access to data camp, a certificate of completion, and entry into our exclusive alumni network. Now you know why you should not even miss this challenge. This is your opportunity to move from being an observer to an innovator, and I'll be excited to see you join the challenge. Of course, you don't want all these opportunities to go away. So do well to register with the link in the description of this video to begin your innovative journey. I can't wait to congratulate you when you finally make it. Aww. So join the challenge now. So that's it for today's update. I hope you had an awesome time catching up on all of these updates. And yes, I can't wait to be back to your face. So see you soon in the next news update. Bye.